Hey there, and welcome to our first episode of Girls Night In. I want to thank you so very much for watching. I am your host, Tawanya Grandin, the actress, and I am uber excited about today. Our production team has been in the lab for months trying to figure out how to bring you a show that's fun, informative, less judgy, and different. So, they did, and they did a great job. So grab a snack, your favorite drink, your plushiest pillow, and don't forget your girlfriends. This is G&I. Well, dang, it's about time. Our guest today is Dr. Crystal Champion, a physical therapist and a certified lymphedema therapist. This White Plains, Georgia native and Medical College of Georgia alum has 12 years of experience in the healthcare industry and currently works for the Emory Healthcare System in Metro Atlanta. In her career, she has received several accolades for her work to include the HCA Innovators Award for Quality Patient Safety, a Clinical Excellence Award, and she is currently nominated for the American Health Council Best Inpatient Care Award. She is also the founder of Champions Can, Foundation for Cancer Wellness Incorporated, a 501c3 nonprofit organization that advocates for cancer survivorship. Please help me in welcoming Dr. Crystal Champion. Hey, girl.
Hello, how are you?
I'm very good. It's good to see you. Listen, I need a hug.
Yes, absolutely.
Oh, thank you for coming.
Thank you for having me.
I'm super excited about you being my first guest.
Thank you. I'm excited to be here.
Yes, and you look gorgeous, honey.
Thank you.
I don't
So
have
do
a problem with
you.
telling you that you look hot. You're not married?
No.
We got somebody on that set that need a wife today? Some baby daddies around? I'm just kidding. You're married. Okay. So, let's begin by talking about what you do. Tell me why you chose physical therapy, and especially in the realm of patients with cancer.
It's kind of a long story of how I became a physical therapist. My grandmother had total knee replacement surgery when I was 12 years old. And so I watched the physical therapist come to her house and give her therapy. And I said, man, if she can get this strong, tough woman that I idolize so much better and able to walk around and do the things that she loves to do, I want to be able to do that. So I knew since the age of 12 years old, 13 years old, that I wanted to be a physical therapist. In working with cancer patients, it kind of fell into my lap, so to speak. There was an opportunity for me to serve on the cancer committee for a healthcare system, and with that came the opportunity to start a lymphedema treatment program. And so with the development of that, like I said, I would say maybe 85-90% of patients I see have cancer. And I see so many people and hear so many people say, well, Dr. Champion, now that my cancer treatments are over, what can I do? I don't know what to do next. I'm left with this functional impairment. I can't lift my arm, or my leg is severely swollen. I can't walk. What can I do? Where do I go from here? So with that being said, that led me to found Champions Can, Foundation for Cancer Wellness Incorporated, to help advocate for those people who can't advocate for themselves and say, I'm not just a cancer diagnosis. I deserve the best care and treatment possible. And I deserve what I deserve. I deserve to be a survivor. I am a survivor, and I need the necessary tools for me to live my best life.
Okay. You need a break after that? That was a whole bunch of mouthful. Tell me, what is lymphedema?
So lymphedema is basically a term for chronic swelling that can happen in the head and neck if you're dealing with head and neck cancer. It can happen in the arm as a result of breast cancer surgery. Or it can also happen in the legs as a result of any cancer-related diagnoses, any lymph node removal, and also a condition called chronic venous insufficiency, where the veins in the legs aren't functioning properly. And lymphedema can also result from a condition called lipedema, which affects 11% of women in the United States. And what that is an abnormal accumulation of fat deposits in the body that fat deposits occludes the lymphatic vessels and the veins, so you end up with chronic swelling.
Okay, so I have some varicose veins. I don't have to worry about any of that, right? That's a whole different.
That is different. Varicose veins, that's a little bit different.
You just made me nervous just now.
No, don't be nervous. Don't be nervous. Usually, like I said, venous insufficiency is a problem that usually you see in people who are obese. They just have a lot of extra strain and pressure on their legs and those vessels. Or, like I said, in the event that someone has had cancer and they've had lymph node removal and the lymphatic system's overload, so the venous system is overload, or vice versa. So it's kind of a cycle to get to that point.
Okay. So then with the lymphedema, how do we treat that?
So the gold standard of treatment for lymphedema is something called complete decongestive therapy, and that has 4 components. So one component is manual lymphatic drainage, which is a very superficial tissue massage to help stimulate the vessels in the lymphatic system to move fluid into the circulatory system the way that it's supposed to. Number 2 is compression therapy, whether it's the form of compression bandages, wearing compression garments, which they make really cool compression garments now. Like they have some of these blinged out tattoo arm sleeves now that are really cool to wear. And the third component would be exercise. Exercise helps to promote the stimulation of lymphatic fluid to help reduce the swelling in the limb. And then component number 4 is proper skin care and nail care. If you have skin infections, nail infections, your skin is not properly cleaned, if it's dry, cracking, those are opportune and prime time for infection, which can make lymphedema worse. So all 4 of those components constitutes complete decongestive therapy.
Seems like almost every ailment that we can have always goes back to exercise.
It does. It does.
Always have to take care of that. As much as I hate it, we have to get, was it 30 minutes? Is it?
It's very important. At least 30 minutes. Some recommendations, like from the American Heart Association, will say maybe 120 minutes of exercise a week. So meaning, you space that out. So that's generally a guideline that you'll see from the American Heart Association.
I don't want it.
It's good for you. Keeps you beautiful.
Okay, in that case, okay. How can women avoid lymphedema? Is there a way for us to avoid it? Or is this a more hereditary issue?
Oh, that's kind of a loaded question. I wouldn't say there's really a way to avoid it, but, and this is the perfect time to say this because we're into Breast Cancer Awareness Month here in October. So I would say, women who have had breast cancer and have had breast reconstructive surgery, or they've had lymph node removal, the best thing to do is to get your doctor to refer you to a certified lymphedema therapist who can be a physical therapist or an occupational therapist, and let them monitor you for lymphedema. Let them take measurements of your arms and see if there's a difference in size, to see if you've developed any swelling. Knowing what risk factors to look for, minimizing the risk of infections, avoiding a lot of blood draws in the side of your breast reconstruction or your mastectomy, avoiding tight, constrictive clothing, knowing what the signs and symptoms of lymphedema is, a fullness in the arm, a heaviness, difference in arm size. I put my blouse on, I'm a size 12, one arm feels fine, the other arm feels tight. Those are often symptoms and signs of lymphedema. Or, I can't wear my rings anymore. My rings are starting to feel tight, or my watch feels tight on my hand. Sometimes it's painful, sometimes it's not. So I would say that the best mechanism of defense is to, have an evaluation by a qualified medical professional who can go through all of those things. And just a general preventative, if you're traveling or exercising, or you notice you have mild swelling in your legs, it's always a good idea to wear compression garments or compression hose, compression stockings, those types of things. A lot of those you can get over the counter. But if you have significant swelling, I highly recommend that you see a certified compression garment fitter or a certified lymphedema therapist who can measure and fit appropriately for your level of compression.
Okay. As a physical therapist, what other common issues do you see amongst women?
Oh, a lot of women come to physical therapy, I would say, with just general aches and pains, back pain or muscle weakness, stiffness in the shoulders. A lot of women after pregnancy can develop what we call pelvic floor dysfunction, where all the muscles here have been stretched out. And so a lot of times it affects your ability to control your urine or your bladder function. So pelvic floor dysfunction is very common in women, especially I would say 40 plus. Some people start to see some changes with that. Also, like I said, women that have had breast reconstruction surgery, they've had muscles affected in the abdominal area. A lot of times they come in with core weakness. That can lead to back pain and other issues. So I do treat quite a few women with varied conditions, but I would say those would be the top conditions that I see.
Okay. We're going to talk some more about some of those conditions a little bit later, because I have a question, a serious question. But before we do that, I do want to ask you about the documentary, Inside My Mysterious Life. We just saw a clip prior to you coming on.
Yes.
Tell me a little bit about that.
So Inside My Mysterious Life is a documentary about lymphedema to bring awareness to the condition and what it is. And as I alluded to earlier, it is a condition caused by it's characterized by chronic swelling, malfunctioning in the lymphatic system. You have primary lymphedema, in which people can be born with it, and then you have secondary lymphedema, which can be a result of breast cancer surgery, chemotherapy, radiation, trauma. So those count as secondary lymphedema. So myself, along with 2 patients that I treated, one with primary and one with secondary lymphedema due to breast cancer, decided that, lymphedema is considered what we call a mysterious diagnosis. You say it, not a lot of people know what it is.
Absolutely.
People recognize what swelling is, but they don't associate swelling with the word lymphedema.
Right.
And to know that it's truly a medical condition that can be treated. There's help for it. So myself, along with 2 ladies, we decided to bring, like I said, awareness to the condition so people are aware and people can be helped. So it's about getting people the help that they need for this. A lot of people are being told that, hey, you're just overweight, you're obese, so that's why your legs are swelling. So if you just go exercise for 30 minutes, 5 days a week and lose weight, you'll be fine. That is not the case with all people. I've had several people come to me and they've been diagnosed with their condition, and by the time they get to me, sometimes it's a little too far gone or it's a little harder to treat and manage. So the whole goal of that documentary is to get the word out there. We want to change lives with this.
Right. It's interesting because you say that, and I'm thinking about all the times when I would see somebody, in any setting, and you have the legs and they'd be super swollen. I always wonder, what is that? And sometimes we, being ignorant, we just think, oh, she's just super unhealthy, super fat, and then taking care of herself.
Oh, she has cankles. Your calf and your ankles running together.
Right.
People say that, but a lot of times, when you see women like that, they have lymphedema, and a lot of times they don't even know they have it.
Right. So get to a doctor. Don't sit on this thing.
Yes.
We got to have a whole nother show about healthcare.
Yes.
And about us actually going into see our physicians when stuff is going wrong. Because your body will tell you.
Yes.
You just have to listen. So your nonprofit, Champions Can, tell me about it a little bit.
So Champions Can was a dream that God placed in my heart. As I said earlier, I work with a lot of patients that have cancer, and after their treatment, I like to kind of say they've been pumped and dumped, meaning they get their treatments and they don't know what to do next to get that optimum level of function. And so it dawned upon me, hey, these people need someone who can advocate for them to be cancer survivors and to be champions through this process. So it was placed in my heart to come up with Champions Can Foundation for Cancer Wellness Incorporated, in which one of the main missions and goals is to promote cancer survivorship, regardless of what the cancer diagnosis is. A lot of times the emphasis is on breast cancer. You hear a lot about that. I mean, you Google and everything you see cancer, usually breast cancer is the first thing that will pop up. However, I thought, well, what about the other types of cancers out there? What about prostate cancer? What about lung cancer? What about skin cancer? What about brain cancer? So I just feel like every voice with a cancer diagnosis, that needs to be heard, and they have issues that need to be addressed. So my organization hopes to encompass care for all cancer diagnoses, whether it's their initial diagnosis, they're right in the middle of having treatment, and then after their treatment has ended. And it also teaches their family. Family members are considered cancer survivors, or friends who are helping people along their cancer journey. They're considered cancer survivors. And a lot of times it's overwhelming for them, and they don't know how to support that loved one. So, like I said, it's about being an advocate for the patient and their family so that they all know how to get through the process.
They definitely have an amazing advocate.
Thank you.
And congratulations on everything that you're doing.
Thank you so much.
You recently had an event.
Yes.
Was it good?
So it was the launch event for my foundation, and the focus of that event was to, again, teach people what cancer survivorship is all about. A lot of people don't even know what that means. A lot of people feel that, I'm not a survivor until I've beat cancer and it hasn't come back and it hasn't recurred, but that's not true. Right. I always say cancer survivorship begins at the time of diagnosis, and it's very important for people to understand that. And even at the beginning of a diagnosis, to go into that well-armed and informed with, what are the appropriate questions you need to ask your healthcare practitioners when dealing with a cancer diagnosis? What it's going to be like before the process, during the process, after the process? What functional impairments am I going to have? How long is it going to take me before I get back to my normal self? So it's very critical for people to understand the whole process.
Amazing.
Yes.
Well, you heard it, Dr. Champion. We're going to come right back. When we come back, we're going to talk about some sweeter sides of cancer survivorship. We'll be right back. So we're back, and I think we may have found Crystal a productive helpmate. You think we found our husband? We have to watch the behind the scenes later on. But now we have Miss Yolanda Scott of Yogi's Creations, and we want to talk to her for a minute. So, Yogi, before we talk about and eat some of these sweet treats, we want to bring you and Dr. Champion together. Because my sister here is currently, do we say battling stage 3 uterine cancer. So, we want to just bring you two together so we can have a little conversation. You're not going to cry. Don't do the crying thing. You know how I am. Okay, she's already tearing up. We need to wait. Are you sure? Okay. Tell us a little bit about when you got diagnosed, and give us a story on up until the day, how you're living your day-to-day daily life with the uterine cancer.
I had abnormal cycles, but I didn't know they was abnormal. I just thought it was just something normal. You know how you have women have cycles and the abnormal bleeding that we are accustomed to, and the pain. And I was going to the doctor, but I wasn't going like normal pap smears and stuff. And my cycles began to get dark, like black. And one day I was sitting at work, and I work in the hospital, and I passed out. And they began to treat me, and they began to run tests on me, and they found out that I had at that time I had stage 1 cancer. And being that you work in the medical field, been in the medical field 22 years, we are worst patients. I wanted to try some other things other than doing chemo, especially not radiation, because radiation was my last resort. So they tried the ablation first. The ablation was first. That didn't work. Then they tried to cut off the blood flow. That didn't work. By the time they tried to cut out the blood flow, I had already went from a stage 1 to a stage 3. So I had to start chemotherapy. I started chemotherapy in 2015 of July. My first treatment, it took my walking ability away. I couldn't walk. I had my legs, but I didn't have no use of it. It took me down just that fast because they had to do aggressive treatment on me real quick, because it had already begun to spread. When they went in to cut off the blood flow, they ran into a problem because they found out that something had grew branches from my uterus to my stomach. They was like, they didn't know how I was walking around. They didn't even know how I was walking from day to day. Technically, I should have been gone because it had started to spread. So now I take chemo twice a week. And I just try to be working in the medical field. I had to stop working because working and trying to take the treatments was taking me down. So I started working in 2016, and since then I've been able to grasp hold to my own health. My eating habits had to change. I had to cut out a lot of things, and stress, being positive. That's why you'll never see me being down about my situation. I don't tell a lot of people because people want to be, oh, I'm so sorry. I don't want that.
We were walking the halls at meetings and at a little party, and she was just like this, gorgeous, dressed up, and looking healthy to me. I would not ever think that a couple years ago that you could not walk. How did you get to a place where right now I can't tell that there's anything going on in your body?
Because when they first took my walking ability away, it was a struggle. They ordered me a scooter. They sent me to the Shepherd Center. They ordered me a scooter. From the scooter, I told my husband, I said, I can't do this. This is not me. I was the go-getter. I have 2 kids. They're grown. My son's in the Navy. My daughter's in college in Kentucky. I went from a scooter to a walker. I was like, I look like an old lady. At that time, I hadn't even hit 45 yet. From there, I went to a cane. I blinged my cane out. I was just doing anything that was going to make me happy. Everything that they gave me, I put bling on it. I was just trying to make myself, but pushing forward to get my walking ability back. When they say I couldn't, I said I could. So even now, they tell me, oh, you cannot do this. You got to be under doctor's care. I'll be like, okay. And I say, let's go walk around the park. And I tell my husband, take me to Piedmont Park. Just let me walk till I get tired. And when I get tired, we stop in the middle of the park. And I'll be like, okay, let me just rest on your shoulder. I do what I have to do because if I listen to them, I'll be dead. If I don't take control of my own ability to fight for me. And that's what people don't know, because when you don't work in the healthcare field and you don't know what medicine will do to you to take you, it helps you, but it kills off so much of your other cells in your body. And radiation is the worst, and I will not take radiation. And we battling with that right now. And I'm just not going to do it. Radiation to me by last resort.
And if I could just say, Ms. Yolanda, thank you so much for sharing that. And like I said, as a physical therapist and someone who you encountered during your rehabilitation process, I completely understand what you went through. And you're right. You can't let a medical professional tell you you can't do something. Never let anyone plant that seed of negativity in your mind. That robs you of your hope, your joy, your strength, your endurance. And I'm sitting here, I can barely contain myself and hold still because you are the prime example of what my foundation is all about. And it's people like you who are willing to share their stories and tell people there is life outside of that. I have stage 3 uterine cancer, but I am beautiful, I'm glowing, I'm successful, I'm pushing through. Absolutely. She is the prime example of why I do what I do and why I'm so passionate about that. So I just want to say thank you. Absolutely. You are a survivor, you are a warrior, and I appreciate you.
Thank you.
And I see a book coming. We speaking that to existence right now, right? Somebody else needs to hear that story. I see a book coming. But we are going to divulge into the reason why you came today.
Okay.
Yogi's Creations, right?
Yes, ma'am.
Right.
So after having to leave my job because I couldn't undergo the pressure anymore and the pain, I had to do something.
Mm-hmm.
So this was my something.
Mm-hmm.
And it's been thriving ever since. So after not being able to work, October the 16th was my last day at my job, DeKalb Medical ER, I started doing this, and I've been doing it full time ever since. And it's a custom apple with my image on it, of course. But I put anybody's image on it. It's pineapple flavor.
Hey, pineapple flavor apple.
Because I make my own candy. It's
So the
not
candy
boxed.
on it is pineapple.
Yes, ma'am.
Okay.
And then this is a chocolate covered pretzel
Give me that.
with little pearls, edible pearls. And this is candied strawberry popcorn.
Open that, Crystal.
Wow. Let's see.
I'm gonna need some soup.
We can tear into it.
Hold on.
Yes, ma'am.
It's gonna be real ugly. Hold on.
I beat you.
This fat
I
girl,
won. I won.
this fat girl stuff. Hold on. I'm at the wrong end of this. Shh, don't be looking. This white chocolate.
It's white chocolate.
Oh my goodness.
I can do this.
All day.
It's not too sweet.
All day.
Mm-mm. You want some?
No,
You know what it tastes
not
like already.
even all.
Okay. Let me
That
see.
is really good.
What's on here?
That's strawberry.
Strawberry, yeah.
The same flavor I use in the
Oh
candy
my
apple.
God.
Okay.
And this is a white chocolate Rice Krispie treat.
Oh my goodness.
And I make my own Rice Krispie treats. This is a
Who is this,
chocolate
Victoria?
covered Oreo. Now, don't make the Oreo.
Who did it?
Nabisco do.
Hold on. Here you go. Let's take it. Thanks. I'm gonna put it on there.
And this is a chocolate covered marshmallow.
Wow.
How are these things priced? How do you price this
So
stuff?
all of my stuff is a la carte, and it come in a dozen. And it's $24 a dozen, like this. But if you go to start and getting the image on them, which most people do, especially for kids parties, then it start going into
Here,
like
get that back.
$40 for 12, because they want personal images or me to customize them.
I'm opening this.
Yes, ma'am.
If you don't stop calling me ma'am, I feel like popcorn in my tea. Y'all gonna, I done told y'all I like the food. How y'all think I got all this booty? Hold on. I'm gonna be hyper for the rest of the day.
Yes, she is.
Okay. How can our viewership get a hold of you?
It's www.yogiescreativesweetcreations.com.
Thank you so much for joining us today.
You're welcome.
We are so happy, and you have been an absolute blessing to me. I know Dr. Champion is
you.
going to go home and just...
Oh, we're gonna have a powwow after this, so you're on my radar.
Absolutely. Let's link up. And I told you, I'm telling you, it's a book coming. And that's our show for today. I want to thank our guest co-host, Dr. Crystal Champion, for hanging out with us today. Be sure to check her out at the upcoming documentary, Inside My Mysterious Life. You can also visit her Facebook page at
www.facebook.com/championscan.
And don't forget, if you ever want to wreck your diet, check out Yogi Creations at
www.yogiesweetcreations.com.
On behalf of the entire team here at GNI, I want to thank you for watching. Until next time, I'm your host, Tawanya Granger, and I want to encourage you to just sprinkle a little bit of love onto everything that you do. See you later.